I just wanted to start out by drawing your attention to the corner of this very busy slide of mine that I will be recording this presentation. So I'll make sure that anybody who's registered for the webinar will have a copy of the presentation emailed to them after we're done. So what I wanted to talk about today, I think you have a bit of an understanding registering for this webinar that I'll be talking about menopause, midlife, mental health, and disability management at work. This is session number 5 in our Fireside chat series from Cardea around midlife women at work. And we will be talking today about just situating this topic in the context of the aging workforce, some issues that are really prevalent for women at work right now, and especially women in midlife and older. Also, I wanted to talk a bit around this policy paper and House of Commons report that have come out in the UK, both within about the last 6 months, and how that might be something that we want to take notice of in Canada in terms of programs for women in midlife and programs around menopause. And then finally, just sort of weaving in the impact on disability management and how some of these issues in midlife for women in terms of lifestyle and health issues around workplace stressors, and then having that overlay of menopause has an impact on just how they're managing at work and how we might better support them to stay at work longer, and around that disability management piece. So I always start by situating the topic around midlife women in the idea around the aging workforce and the impact that that's having in Canada. So I would draw your attention to one of the last long form census years, pardon me, that was in 2016. It wasn't our most recent census, but it was one of the last long form census years in 2016. And the reason that I'm talking about that census year is because during the 2016 census, the number recorded for the portion of the workforce that was over the age of 55 was 36% of the working age population. And that was the highest number on record since StatsCan had been collecting records in the mid-70s. So that was pretty significant. And the projection is that 40% of our working age population by 2026 will be over the age of 55. So a pretty large portion of our workforce over the age of 55 just in 4 short years. And women are one of the fastest growing demographics within that population. And in fact, one of the projections also is that women will constitute 1/3 of all of those newly hired by 2026. So women over the age of 55. So I hope by the end of this webinar today, I can convince you that focusing on supporting women in midlife and older will have an impact on how many female leaders we have in the workplace. We can help slow retirements. We can help manage some of those disability management costs. And we can just make a more gender equitable condition in the workplace. So why am I talking about this topic? Well, I'm Kate Milne. I am a healthy aging specialist. I'm a community-based health promotion researcher, and I have spent the better part of the last 2 decades helping government and cities and organizations plan for an aging population. I also spent about a decade working in disability management and vocational rehab. So I bring that lens as well to my work. And these days, I spend the bulk of my time helping organizations to engage, retain, and recruit their midlife and older female talent. And I do that by helping them focus on becoming more age-friendly as organizations. So I wanted to also start out by just having a quick poll, because I think it's an interesting question around whether or not your organization is including age when we think about that aging population in your DEI strategy. Is that part of your mandate? So I'm just going to put up that poll, and maybe you could let me know. And it's an interesting question. The reason that I'm asking is because this is a really hard number to get in the research. So trying to find the number of organizations who are including age in their DEI strategy is tough. Some people talk about this number of only 8% of DEI strategies have age as part of their mandate, but I think that number was from quite a few years ago, and it's hard to find the original source. So I'll just give that one more minute, and then I can share the results with you. Yeah, so not surprisingly, it looks like most organizations, or most folks at organizations, don't know if age is part of their DEI strategy, or that's not happening at the moment. So this is what I hear anecdotally. Again, it's hard to find the actual numbers in research, but I do hear this anecdotally that in most organizations, this is not really on the radar so much. So I think we need to start also by talking about what's going on for women and women as they age in the workplace. So beyond organizations not necessarily focusing on age in their DEI strategy, there's not always a focus on women in midlife. And I'll talk more about some of the issues around that are less of a focus, things like menopause. But if we just think about what's going on for women at work generally, especially since the beginning of the pandemic, women have not been having a wonderful time, not surprisingly, at work overall. And in fact, when we look at some of the numbers from surveys done recently, there was a survey done by Deloitte that was released in 2022 around the state of women at work. And in that survey, there was about 5,000 women in 10 countries around the world. Canada was one of those countries, of course. And we know that from that survey, only 50% of women plan to stay in their position in the next 2 years, and only 10% of women plan to stay for 5 years or more. So a lot of women have this really high intent to leave the workforce, and that's in all age groups. But with Qualtrics, another organization, found in a similar survey, but they did it in 27 countries, 14,000 women in this survey. Again, Canada was part of that survey design. And within the results of that survey, they found that female leaders were leaving at the highest rates of all. And we know that women in leadership, in management positions, many of those women tend to be in midlife and older. So we have this issue of a lot of women with intent to leave, or women who are actually actively leaving the workforce. So there are a few things going on when we think about why women would have this really high intent to leave, or why they are leaving the workforce. One is around this idea of hybrid work or flexible work arrangements. But if we just think about hybrid work itself, women in that same Deloitte survey talked about feeling excluded from having opportunities to advance when they were working in hybrid positions, that they felt like it had an impact on their career. And those are the women who had access to hybrid working arrangements. So most of the women in the survey said that they didn't have access to having flexible or hybrid working arrangements, but the ones who did indicated that it wasn't always something that was a good choice for their career. They felt like they were missing out on opportunities to meet with decision makers, that they were sort of being put to the side because they had asked for these flexible working arrangements. And so that piece is interesting because I think that's something that a lot of women had to do out of necessity around caregiving and so forth during the pandemic. The other thing that might surprise you that was a finding in the Deloitte survey was that from 2021 to 2022, more women reported microaggressions and harassment at work. And this could be anything from unwanted physical contact all the way to interrupting and disparaging comments. So that went up by almost 7% in 1 year. So women were finding, more of these microaggressions at work. And of course, women in the BIPOC community, LGBTQ plus folks were finding this more than at higher rates than others in the survey. I don't think it would surprise anyone to hear that women reported a very high level of burnout and stress. This is a conversation that we all know is happening a lot in the workplace right now. We're talking a lot about burnout and stress. In fact, we did one of our most recent Fireside chats talking specifically about burnout and stress in midlife women. But 53% of women in that survey also indicated that their stress was higher than a year ago, and almost half of them reported feeling burned out. So 1/3 of women also reported that they'd taken time off because of mental health concerns. So this has, of course, a really big impact on the workplace, this issue around stress and burnout. And again, something that I think is on the radar, but is an important piece to mention in putting this puzzle together. So thinking about workplace stressors, and then when we think about midlife and some of the things that are going on outside of work, or maybe some lifestyle issues for women in this age group, there's this piece of research done, the Seattle Midlife Women's Health Study that was released in 2018. It was a longitudinal study over the course of 23 years. So looking at women as they transition through midlife and into later years. So a really interesting study. And what the researchers kind of came up with for their synopsis of how to describe this point in life was that women were searching for balance in the midst of co-occurring stressors, so multiple co-occurring stressors, while coping with losses and transitions, and usually in the face of very limited resources. So that doesn't necessarily just mean financial resources, it means support as well. So a lot of things going on. So in midlife, for instance, the risk for chronic disease goes up, and it goes up even more substantially around menopause and the menopausal transition. And I'll talk more about that in a little bit. But our risk of illness goes up. And so women start to deal with things like higher blood pressure, diabetes, risk for cardiovascular disease and stroke. And of course, they're also dealing with risks for developing a mental health condition. And again, I'll talk about that more. Caregiving is also an enormous factor at this time of life. So not just caregiving children, and of course, not everyone has children, but women who have children might have children in teenage years, kind of a challenging time for many, or they might have that transition of kids going off to school. But at the same time, they have caregiving a lot of times for elderly relatives. And this isn't something that many of us plan for. So many women do a bit of planning around maternity leave. They, do planning around having children, but very few of us plan to care for an aging relative or parent. And 2/3 of informal caregivers in Canada, informal means unpaid, are women. So the folks who are taking care of our older adults are typically daughters or nieces or friends, and many of them are women. I think one of the most profound numbers during the pandemic is that there were 4 times as many people out of the workforce caring for an aging relative or a spouse or someone else, an adult, than there were parents out of the workforce caring for children. So caregiving is this big issue that's not talked about a lot at work. And I think it's one of those things, especially for women, that they keep sort of under wraps because there's a worry about how this could impact their career, that it might seem, that they're distracted with something going on in their home life. But caregiving is a really, really significant issue. It takes a huge toll on mental load. And it's something, again, that we're not talking a lot about. So we have health issues, workplace stressors, caregiving, and then on top of that, the menopausal transition years. And there's a lot of things going on during that time. So, sorry, my mouse is not working very well today. So I'll start by maybe just talking about menopause and give you the quick synopsis, Menopause 101. So menopause itself, that word menopause, is just what happens, or the marker for 12 months after a woman has her last menstrual period. And we talk about postmenopause after that happens. But, there's a lot of time prior to menopause occurring in those menopausal transition years, where most of the fireworks are really going on. This is where there are a lot of health issues and symptoms. And I'll use the word symptoms. I think some people have resistance to that word when we talk about menopause, because they don't want to have menopause maybe put in the same bucket as an illness, that this is something that's happening and will happen to every person who has a uterus. But I think symptoms gives us that common language, so I'll use that throughout this talk. So menopause, the menopausal transition happens, it can happen for women, it can start even in their late 30s. And for a lot of women, this is happening in, their 40s, and the actual occurrence of menopause itself is typically somewhere between 50 and 52. So women can go through 10 or 12 years potentially of things that are going on in terms of symptoms and health issues prior to that final 12 months after their final menstrual period. So this is a time of just hormonal chaos for a lot of women. The number one symptom that women report is around sleep loss, so problems with sleep. There's problems, of course, with hot flashes or hot flushes. These are what we call vasomotor symptoms. So things like also night sweats. There's also problems with memory and concentration for some women. Anxiety and depression can develop. Some women talk about things like joint pains and stiffness. There's a lot of different health issues that are going on potentially as a result of this change. And so women are experiencing a lot of this, as I say, for many years during that transition time. And what's interesting is, if we had another condition where women were having symptoms in this same way, it would probably be something that we would allow for in the workplace typically. But again, another survey done by a telehealth company, Genève, they surveyed women who self-identified as being in that menopausal transition, or some people would talk about perimenopause. So they were in those years, and women who were in postmenopause as well. And almost all of the women who were surveyed indicated that they didn't have any sort of benefit or support at work for menopause or the symptoms of menopause or going through that transition. And yet, a quarter of those folks had also taken time off work because of the symptoms and trying to manage, but they had hidden why they had taken time off work from their employers. And further, in another survey done by Carrot, a fertility benefits company, they found that, and again, they were looking at the same sort of group. They were looking at women between the ages of 40 and 55. They found that 47% of the respondents in that survey indicated that they would consider looking for a different job that allowed them to be in remote or hybrid work so they could manage their symptoms more effectively. And sadly, about a quarter of those women also indicated that they would consider retiring early or shifting to part-time work. So, the risk is that we're losing women around this time and around these symptoms because they don't necessarily feel like they have this support at work. And around those menopause symptoms, there's also, I think probably most of us are aware that there's a bit of a taboo around talking about menopause, just generally, but especially in the workplace. And so this also has an impact on things like job satisfaction. In the UK, in the inquiry that I'll talk a little bit more about in a moment, there was a survey that started some of that, the wheels in motion for the inquiry. And again, they found the same sort of results, that a third of the women in that survey said that they'd been unable to go into work because of their symptoms, or they'd taken time off because of their symptoms. And one of the really interesting parts of that survey, or the findings in that survey in the UK, was that women who had taken a long-term absence had taken on average 32 weeks off to manage the symptoms of menopause. So women who are struggling with more severe symptoms and needed to be off for a longer time, 32 weeks off work. So again, a pretty significant time off work. Sorry, my mouse does not want to work today. There we go. So thinking about this, again, I'm interested in knowing, does your organization, maybe you can answer this other poll for me and let me know if your organization addresses menopause. So this could be in any way, if you have a menopause awareness program, if you have any sort of benefits, if there's anything that your organization is doing around menopause, maybe you could let me know. I'll just let that go just for a minute to see if we can get any more answers there. Yeah, so it looks like one organization is, I'll just share these results with you. It looks like one organization is offering some sort of menopause support, but not the rest of the organization. So not surprising at all. I know that folks are joining us from around the world. There's folks joining from New Zealand and the US, Australia. So different things going on in different countries, but in Canada, at least, there's not really a big focus on this as of yet. So thank you for helping me by answering that poll. And this is the other thing I think that we need to consider when we're thinking about menopause in the workplace is this doesn't exist in isolation. That the reason that many women feel reticent to come forward with the symptoms that they're dealing with or struggling with health issues, or even some of those things that are going on at home in terms of those lifestyle factors, things like caregiving or health issues or dealing with sandwiched caregiving. Part of this is around this feeling around gendered ageism. So we know that we know that ageism is something that's going on in most workplaces to some degree. And this could be ageism at any age. It doesn't necessarily have to be just as folks get older. But we know that when the AARP surveyed people about their experiences in the workplace, 9 out of 10 people who were over the age of 45 indicated that they'd experienced some sort of ageism at work. And so ageism is, something that we see happening, but it's even more profound for women. When we have that overlay of gender on age, then we know that women are being called back less for interviews. They're experiencing more job losses. Anecdotally, a lot of women talk about being packaged out to make way for younger employees. And part of that gendered ageism piece is the visual piece, that women worry about the appearance of getting older. And as they get older, are they less relevant? And what I mean by that is when it's evident that they're getting older, will their employer decide that they're less relevant and less important to the company? So menopause in the context of that is a very visual expression of getting older. If a woman is in a boardroom and suddenly having a hot flash, it's a pretty obvious sign that she's getting older. And it's one of those things that a lot of women feel really uncomfortable having that visual in the workplace. And so many women don't report some of these lifestyle or health issues to their managers because they worry about the repercussions. And again, in a lot of these surveys that I mentioned, one of the questions that they asked was about reporting. Do you report at work? And women, respond in again, multiple surveys. A large number of women respond that they don't tell anybody, that they keep this under wraps because they don't want to suffer the repercussions. So part of the name of this webinar was around mental health, menopause, and midlife. And so I think there's this really interesting piece as well that we need to recognize. So hopefully I've made the case that there are those multiple co-occurring stressors for women in midlife and older. And those, of course, will have an impact on mental health in terms of stress and burnout. But during the menopausal transition, there are some other things going on. And one of the big researchers in this area, Claudio Soares, talks about how during the menopausal transition, or even just during reproductive years, that women are at a higher risk of developing major depressive disorder, about 1.7 times higher than men. We're at risk of developing depressive episodes, major depressive disorder. But during this menopausal transition, we can also look to the idea that in the different parts of the brain, we have these estrogen receptors, and the parts of the brain that are of concern, I suppose, during the menopausal transition are around things like cognition and core body temperature and mood. And so when we have shifts in those levels of sex hormones during this time, it can have an impact on those different, the different regulation of those centers in our brain. So there's been some really interesting and important studies in this area. The Harvard Mood and Cycles study, the Penn Ovarian Age study, and another study by Pascali et al. In 2018, which again was a good longitudinal study looking at major depressive disorder. And all of these researchers have sort of come up with this collective term, or they've coined this term called the window of vulnerability. And the idea is during the menopausal transition that women are in a window of vulnerability to have a depressive episode. And this can even be a first bout of depression during that window. And women are also at a higher risk if they've had a previous depressive episode during the menopausal transition. And part of this is those changes in sex hormones and the impact on the brain, but it's also the lifestyle stressors that I talked about. Of course, at work, we also have those stressors. And then we also know that things like hot flashes and changes in sleeping, some of the things that are going on as a result of menopause and those symptoms also have an impact on mood. So there's a number of things that can contribute to developing depression or a depressive episode at this time of life. So there's two things that I think that we need to think about. It's not only mood, but it's also cognitive changes during this time. And I want to be really clear. This isn't that, women's cognitive ability goes downhill. This is a transient change during the menopausal transition where women can have changes in things like memory or concentration, in verbal processing speed, sometimes even in their fine motor skills. And again, it's those fluctuations in hormones. But it's very distressing for a lot of women. And I hear from a lot of women, I think I'm going crazy. I think I'm developing dementia. It's a real worry, and it can be a worry at work when we add stressors on top in terms of how we're managing, memory and concentration. But then there's also, as I mentioned before, those mood changes that can compound some of the problems with cognition. And again, women are at a higher risk during this time, but they're especially at a higher risk if they've had any previous depressive episode during their reproductive years. So especially things like postpartum depression put women at a much higher risk of developing depression during the menopausal transition. So some really interesting things going on, and some things that I think we need to recognize as well in the workplace. So it's a lot of information. And the next piece that I think is really important is, what is this costing? What is the cost to having women not be supported during this time of life, during some of these health issues, if we just leave this unaddressed? Well, right now, I think it's difficult to put a dollar value. I do know that there is a paper that I've read from the US that was released, I think, in 2018. And the researchers talked about $250 million in direct and indirect workplace costs. But this is one of the more recent numbers that was suggested by a healthcare and life sciences organization, and they talk about $150 billion in workplace productivity losses. This is globally, but the same folks who suggested this number said it could be as high as $850 billion. So this is a huge number in terms of productivity loss. Now, I think it'll be interesting to see, and I'll talk more about this in the UK example when they do work on quantifying this, maybe in a bit more of a structured way. But it's, again, something that it's a significant cost to organizations, and they may not even know that the cost is happening as a result of menopause or some of these midlife issues. It may be that women are just leaving the workforce or having sick leave or disability leave on a different claim basis. So in the UK, there is some pretty interesting work going on right now. And the reason that I'm looking to the UK as a healthy aging researcher and just thinking about aging research in general and policy in general, we look to the UK quite often. They tend to be a few years ahead of us in terms of the innovation and the work that they're doing. And they're usually a great source to go to. So in the last few years in the UK, there has been this movement towards supporting women going through menopause in the workplace. And this, as far as I can tell, it was sparked by a survey that was done in 2019 around how women were managing at work in the going through the menopausal transition. And this sparked a House of Commons inquiry into menopause in the workplace. And so they wanted to look at both workplace practices, but they also wanted to look at discrimination based on menopause itself. And they wanted to know both the nature of discrimination and the depth of that discrimination, or the extent of the discrimination. And the idea was looking at whether further legislation is needed to actually have a legislated requirement for employers to have a menopause policy in place. And this was a group, or is a group, of 11 MPs, and it is organized in the Women and Equalities Committee. And their work, again, is looking at those different parts of menopause in the workplace. Some of the things that they learned from the survey in 2019 was that most women at work experience menopause symptoms, and that those are affecting them negatively. And despite this going on, there's still this really significant stigma of menopause at work, and not really wanting to talk about it and not reporting this to managers. So one of the issues, or I guess the parts that came out of this inquiry, was still a bit of a divide about whether or not to legislate having mandatory menopause policies at work. So that's I think, a bit of a stay tuned moment, and I will talk about that a little bit more as well. So one of the reports that they released, this was just released in July of this year, outline menopause in the context of three things: in the context of health, in the context of the workplace, and in the context of the law. Now, the overall report was about menopause at work. So it's really around workplace, but they wanted, I think, to split this out so we could understand how menopause in the workplace impacts different areas of focus. And so around health, part of it was around social attitudes towards menopause itself. And I think a lot of women at this time of life would tell you that they struggle with getting properly diagnosed, with having care that takes their condition seriously. Many women will talk about being a bit brushed off by their doctors, that the doctors say it's a normal part of life, just sort of get on with it. Many women struggle with getting proper medication if they want to take that. And even having healthcare professionals that are well educated in this area. So that's definitely a concern and something that's outlined in a bit more detail in this report. In the work portion of the report, they talked about 3 different categories that they think should be addressed. This is around problematic symptoms and how we help women with that, around the lack of support and discrimination in the workplace that happens as women get older, and then how to deal with loss of income and reduced work. So these are 3 sort of focus areas in that report. And I, of course, today don't have the time to go into huge detail on that, since the report is about 56 pages, but I will post that report along with the recording of this webinar today. And then the other important piece, I think, that may be of interest, and again, if we're looking to the UK as a place where a lot of these things around aging and healthy aging happen a few years before Canada, they've actually looked at how their laws are not protecting menopausal women, and that menopause isn't a protected characteristic in their legislation right now. And there is a push towards making this a protected characteristic. And again, I'll talk a bit more about that in a moment. Some of the things that came from that report that were really interesting were recommendations around what should happen in the workplace. And again, I'm going to talk about this a little bit generally, just because if I had more time to talk about this, and I probably will talk about it in more detail in our next Fireside chat on October the 27th. So they talked about having more openness and awareness training, not surprisingly, when menopause is such a stigma and something that we don't talk about. Having that kind of openness to talk about this topic and have it be part of leadership training, part of management training, I think is really important. But also having specific menopause policies and guidance for employers. How do we put this into action in the workplace? And along with that, having sickness policies that work for menopause. So women aren't hiding this or taking sick time or taking disability leave and not talking about what's really going on. And then those flexible working arrangements, we keep coming back to that. I think when you're dealing with a condition that is limiting sleep, that's having an impact on your health, having that flexible work life is maybe a bit more supportive. The second interesting paper that's posted in the UK was from a different task force that put together, or I think it's a complementary task force that put together some of these recommendations, specific recommendations from some of this work. And this was released a little bit before that big paper from the committee, that paper that I just mentioned. But this policy paper, sort of working document, was released in November of last year. And so in those recommendations, one was nominating a menopause ambassador. So these were recommendations sort of government-wide. How do we change the whole landscape around this? And the idea, really, the crux of all of it, is that the government wants to work with employers to form a collaboration to make these changes in the workplace without having to legislate it. I think without having to go in with legislation to begin. It's starting with having these collaborative changes. So from the government's perspective, this would start by having a menopause ambassador, so a dedicated person to work on this portfolio. And that person would really promote the interests of women, the economic contribution of women during this time period, the missed productivity, the missed tax base, and then supporting folks in that in maybe more marginalized communities as well. So having that protected characteristic along with other characteristics. So this is part of the Equality Act. Section 14 is making that menopause a protected characteristic. So that could bring forward dual discrimination cases. So on the basis of menopause and making this a priority issue in the government's public policy agenda. And along with that, really quantifying that cost of menopause, putting a structured program in place to figure out those costs. What is it truly costing employers and government in terms of this issue at work? And then maybe shifting to a more holistic view of the menopausal transition. And this is what I would also urge people to think about, is menopause doesn't exist in a vacuum, that this whole time around midlife is something that we probably should be looking more closely at and providing more support. And then these were the specific recommendations for employers, and then just a little in terms of overall societal recommendations, or maybe more around public policy. So one was having this government-led, as I mentioned, or government-backed, an employer-led campaign to work in conjunction with that menopause ambassador. So really making sure that this was a collaborative effort by the government and employers together before moving towards legislation. And then having this open conversation, really, really supporting open conversations at work. And the policy paper even goes as far as to recommend adding this into employee and family assistance programs in terms of support. And training line managers, acknowledging that people affected by menopause are going to be affected in different ways, and just having some of that. I keep going back to that awareness training, but it allows kind of signposting for further help. And then around the societal piece, really thinking about some of the money and pension services. So if women do have to go off work or retire, how can that be supported in a public way? And then that transition awareness in public policy. So thinking about that in bigger public policy ways, so beyond just the workplace. So I hope all of that information is helpful. Some of the things that I think would be helpful when we think about all of this information together, the stressors that women are facing, some of the issues around menopause, some of the recommendations that are being made in the UK. These, I think, are some of the key steps that we can do to help support women at this stage. One would be really auditing your policies and programs to see how age-friendly they truly are. Are we including this in DEI strategies? Are we looking at how women are going through their entire life cycle at work? And are there places where we can provide more support? We definitely have become better at providing support around maternity leave. I think this is the next thing that we really need to be looking at. And again, when we think about maternity leave, it's not all women. When we think about menopause, it is all people with a uterus will go through this transition. So making a commitment to menopause awareness and training, and I think you want to make sure that you have good quality awareness and training in this area, making sure that we have folks who are qualified to give information around that, and making sure that that is a priority issue for leadership as well. Providing non-punitive flexible working arrangements. So what I mean by that is if women are taking on these flexible roles at work or hybrid working arrangements, that they aren't suffering the consequences in a way that their flexible working arrangements are something that's putting them to the sidelines, it's made clear that by working in a flexible working arrangement, that they still will have access to promotions and support. And then considering menopause related sickness policies, I think would be something novel and key, and probably make many employers an employer of choice, that just even by recognizing that this may be a time in life where women have to use their sick leave or benefits differently, and allowing for that and providing a policy around that, I think is really important. So it's 10:51. I hope that's been helpful. I am happy to take any questions. I wanted to let you know that I will be doing another fireside chat on October the 27th. I'm going to be talking with Teresa Isabel Diaz, who's a menopause expert. She's certified by the North American Menopause Society, and she will be talking to me about some of the nuts and bolts for women around menopause in the workplace, and so specifically some of the things that women themselves might want to consider. We'll just go into a bit more detail in that talk. So I hope you'll join us on the 27th. And I've just put my information up here. If you have any questions for me that you think of after this session, or you'd like to connect, you can use that QR code to book a time, or you can just contact me in any of those ways. So I'm just going to check the questions and the chat. It doesn't look like I have any questions at all. I'll just leave that for 1 second, and otherwise, thank you for joining me.